Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Scott here visiting us today, referred here from the VA through Tri-West. Is that correct?
Yes, sir.
Yep. And you requested that too, right?
Oh, yeah.
Whenever you went through Tri-West to get a referral here?
I specifically mentioned your name in advance, so yeah.
And they didn't have any problem referring to you either?
Oh, no.
Yep.
Oh, no.
So we treat a lot of veterans here, and want to thank you for your service to our country too.
You're welcome. Thank you.
It's an honor for me to be able to treat you guys.
All right.
Yep. Now, Scott's already had lumbar spine surgery, laminectomy at L5S1, and he said that he got some good results from the surgery initially, getting rid of his butt pain, but now he's got low back pain coming back right down at the L5S1 area, and I just did an exam on him and found out that he was subluxated down in the L5S1 area as well. So today will be his very first treatment here at Advanced Chiropractic Relief. He's had low back pain, neck pain, numbness and tingling down in through his arm, all the way down into his fingers, right SI joint pain, mid-thoracic and upper thoracic pain, also occasional headache, well not occasional really, or once a week, that's frequently actually. Did I miss anything? I think that was pretty much it, wasn't it? Besides the muscle achy soreness all the time.
Just soreness, yeah, basically.
Okay, so we're going to show them how we adjust you here. Scott, let's go ahead and show them your posture first, though. Let's have you flex your head forward and backwards for me, please, sir. And then back to neutral. Okay, so see his head forward and translated to the right, but he's also rotated on the y-axis, negative theta y cervical. Is rotated and translated to the right. Shoulders right behind the left one, and the right pelvis is rotated posteriorly as well. Now he brought his MRIs in and his diagnostic tests, so I've already reviewed those with him. And interesting enough, he had low back surgery, but guess where his majority of his pain is now? In his cervical spine. And he brought in his cervical MRI, and we looked at it here a few minutes ago. And he has what's called a reversal of the cervical curve. The curve in the neck is supposed to be a nice, smooth, forward arc called a lordosis. But in certain cases, just like him, if people are looking down a lot, or they're sleeping on a big pillow, or they're reading or texting all the time, or on the computer all the time, you start reversing that curve in there. But I suspect some of his came from his military activities, because he was with the 101st Airborne and jumping out of perfectly good airplanes. That's what you're going to tell me. You know, I'm a daredevil in most everything in my life. However, I have never really wanted to jump out of a perfectly good airplane.
It's fun.
Smart. Now, the very first time I went to watch a skydiving thing, a guy's chute didn't open. He bounced off the ground about 10 feet. And I haven't ever wanted to go skydiving since. The guy was trying to talk me into it that day, but then I saw that guy fall to the earth, terminal velocity. That kind of changed my mind pretty quickly. Those kind of things tend to leave an impression on you. Did you ever experience that, Scott? Watch anybody hit this
No, never.
ground at terminal velocity? Yeah, it was freaky. Now your legs are exactly even. This should feel a little less tight in your low back this time.
Oh, yes.
Yes, sir. Good. Okay. So I'm going to get that curve that we talked about going back forward in the Z-axis. There you go. Good. Okay, let's turn you on your back now, please, sir. Okay. Good. Let's slide down this way. No, that's a little too far. Just up that way, about half an inch. There you go. Good. Now put it a little straight out. So, you know, I've been treating veterans since the VA started doing this outpatient referral system. It used to be called P-bases. Still is, I think, in some areas. It's called Veterans Choice, I believe now, isn't it?
Choice care.
Choice Care. There you go. Should have felt that all the way up in your
Oh,
lower
yeah.
back there, Scott.
Yes, sir.
Good. Let this go. That's it. Perfect. Good job. Okay, let's sit you up and face that way, sideways. Yep, there you go. You know, I just want to mention this too, because we treat so many veterans here at Advanced Chiropractic Relief. There we go. I implore the VA, as well as chiropractic colleges and medical schools, or whoever has the availability to do research, and research the difference in traditional orthodox medical care of the veterans, which you need. I mean, I'm not saying you don't need medical care for issues, but we are drugless and surgeryless. We don't do surgeries and we don't prescribe medications.
Great.
I never tell patients to stop taking medication or start taking medication because that's not in our scope of practice. But chiropractic is the best natural alternative for all you guys.
Oh, yeah.
Without having to take drugs or go through surgery.
Yeah. Popping pills is just, it's a Band-Aid.
Well, it's habit forming
It's
too.
habit forming. It's
Can ruin your life.
not good.
Yep.
Yeah.
So this is a great alternative way to get natural relief and healing in your body. Okay, now just lay back on your back for me, please. There you go. So in this one, Scott, I'm going to pin both of your pelvic bones, iliac crest in here, so I get a good fulcrum to work from.
Okay.
And then I'm going to decompress your spine from the occiput all the way down to your sacrum on the y-axis. You can put your hands right here for me, please. And specifically, I would request that the VA and the chiropractic colleges do research on this technique, on the XYZ Johnson technique, which is biophysics, not chiropractic biophysics, but biophysics as named by my good friend Dr. Dan Murphy. There you go. Straight y-axis. You should have felt that all the way down, Scott.
Oh, yeah.
All right, keep breathing. Don't hold your breath.
Okay.
There, you're still kicking. You're right. Yes, sir. That's a wow adjustment. Tilt left for me. Yes, sir. Tilt right. There we go. In fact, Tristan is taking the Johnson technique to Palmer College of Chiropractic as we speak. He's probably in Davenport today. Hey, Tristan. We're still treating all of our veterans here in Houston. Okay, here we go. Sideways, sideways. You don't ever say straight up because the verb will slip backwards.
Sorry.
Okay, you don't have to apologize here.
Okay.
I just point something out that'll help you to help yourself.
Okay.
Get up sideways, it'll be better for you.
Okay.
Okay, let's have another look. Flex you forward, backwards, and then neutral. Okay, there we go. Okay, you might want to spread your feet just a little bit. There you go. Good. Then see, you're forward, so we're going to come straight back first, then look back. You'll feel a little tap on your atlas there. Right there. Okay, relax. Now try that very same move again. Flex forward and backwards in neutral, and you tell me if this feels any different to you this time.
Oh, absolutely.
What's the difference?
It's the pain level just went from like a 7 to maybe a 2,
Okay.
or lower. It's I have mobility.
Yeah, it's felt smoother to
Absolutely.
you.
Yes.
Great. Well, this is your very first visit here at Advanced Chiropractic Relief. Would you mind sharing with your fellow veterans around the United States what the benefits you've seen from just this first visit?
Absolutely. As a veteran, and I'm not knocking the VA has been wonderful. They've actually approved this, but
Yeah.
I would say
Well, they did a lot too now.
yes,
We're getting tons of veterans coming in here,
absolutely.
which is great because we love serving you. You guys deserve the best of what America has to offer.
Yes, I've been to chiropractors in the past, and that's the reason I'm here. This guy is the best, and absolutely take advantage of it. It's worth your quality of life is worth it.
Yeah.
So
Well, thank you so
Thank
much
you.
for those kind words.
You're
That's
welcome.
very-
Thank you.
I'm
God
honored
bless.
to treat you guys.
all right.
God bless. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we take care of our United States veterans with honor. We'll see y'all soon.